There are a lot of half-truths and misleading information on ovulation and getting pregnant. Welcome to the Health Show, your number one health content provider. Now, trying to conceive or not conceive makes you available to all sorts of information and theories and advice from concerned family and friends. Ordinarily, information like that may sound reasonable. For instance, hanging on holding your leg up for some time after sex to enhance the movement of sperm to the fallopian tube, okay? And or taking extra lime or juice and grapes to prevent you from getting ovulation. Both advice make sense, but they are not accurate. Okay, there are a lot of rumors out there. Meanwhile, healthy sperm cells are good swimmers regardless of the sex position. That's for my couples anyway. By definition, ovulation is when a woman's body releases her egg from the ovary, traveling through the tube toward the uterus just after her menstrual cycle. You must have heard that a woman's cycle is 28 days and ovulation is on the 14th day, which is the midpoint. That is the correct average. What is entirely wrong is assuming that every woman ovulates on the 14th day of the menstrual cycle. Ovulation may occur on day 14, as early as day 6, day 7, or as late as day 19 or 20, which is normal, and this depends majorly on the length of the woman's cycle and other factors that can affect ovulation and maybe cause stress. A woman with good fertility may have a cycle as short as 21 days or as long as 35 days. Knowing the length of your menstrual cycle is very important in determining your ovulation day. So what are the signs of ovulation? How do you know that you're ovulating? Well, it is pretty simple. Common signs of ovulation are changes in the cervical mucus, breast tenderness, a rise in basal body temperature, you're just feeling hot all of a sudden, and increased sex drive. Now, pelvic pain is also one of the common symptoms of ovulation. Why some women are complaining about their occasional pelvic pain that they feel during ovulation, other women are seriously battling infertility. Now, there's a direct relationship between ovulation and fertility. If there's a problem during ovulation, it can lead to infertility. Now, some of these problems are irregular periods. If your period is too long, too short, irregular, or you don't experience periods at all, there is a high tendency for you to have fertility issues. By the way, there have been a lot of misconceptions about fertility. One particular and one popular one is linking cough medicines to fertility. Now, the rumor says that taking a lot of cough syrup will help improve fertility. Sadly, it can't. Now, the idea behind this misconception is that cough expectorants, which thin mucus, could enhance fertility by addressing the cervical mucus thickness. However, taking these expectorants has not proven to reduce cervical mucus thickness, so it therefore has no relationship. Now, infertility is often more complicated than just cervical mucus concerns. Another common myth flying around in Nigeria today is that your lifestyle cannot have any effect on your fertility. Now, this is false. Lifestyle habits like obesity, alcohol consumption, and smoking can hasten the release of a woman's egg and increase the risk of ectopic pregnancy. Now, for instance, women undergoing fertility treatments often quit smoking as it can hinder positive outcomes. Now, even if you eventually get pregnant after conception, smoking raises the risk of miscarriage, particularly for women who become pregnant through in vitro fertilization. In the later stages of pregnancy, smoking can lead to congenital disabilities, growth restrictions, and high maternity blood pressure. Now, when aiming to quit smoking, consider a gradual approach instead of an all or none mindset. Even reducing the number of cigarettes can positively affect fertility and bring health benefits. All right. Now, you need to know that there is no level of cigarette smoking that has been deemed safe during pregnancy or ovulation. So you have to quit all of that. Now, figuring out how to tackle infertility is like a puzzle, and it depends on the several factors rather than just one. Now, there's also the aspect of fertility window. These are the magical days in a woman's cycle when baby making is on the table. Now, this window isn't one size fits all. It dances and beats around for different women because of their different cycle. Sometimes the cause of infertility can't be traced. If about 3 years of trying doesn't lead to pregnancy, there are treatments like assisted reproductive technology. Now, you need to know that going into treatment involves some severe commitments, financially, physically, emotionally, and time-wise. Every woman's fertility journey is unique. Some find success with just a treatment or two, while others might need a mix of therapies to get that positive result. Now, if you're having difficulty ovulating, talk to a gynecologist and we'll be able to talk you through on how to calculate your ovulation period and be able to address whatever is stopping you from getting your ovulation. Thank you for watching. Remember to subscribe, like. I really hope you learned something from this video. Bye for now.